We continue with the window of heaven points, lung 3, heavenly residence. Location on the medial aspect of the upper arm, tritium distal to the end of the anterior axillary fold in the groove on the lateral border of the biceps brachii. How to find? Ask the patient to flex the biceps muscle against resistance. Locate lung 3, tritium below the anterior end of the axillary fold in the groove on the lateral border of the biceps brachii. Sometimes you can feel it on the brachial artery here. By the distance of 9 between the end of the axillary fold and the cubital crest. In thirds, and locate lung 3, a third of the distance from the axillary fold. Lung 4 is located in the sulcus. 1 tube distal to lung 3. EC2 is located 2 tube below the axillary fold between the two heads of the biceps brachii muscles. Middling vertically 0.5, 1 tube. Occipital is contraindicated according to some classics. Action indication, it regulates and descends the lung chi, clears lung teeth, pulls the blood and stops bleeding. Comes to the corporeal zone, opens the channel and alleviates pain. Special features, window of heaven point. The action and indication of this point are closely related to its being a window of heaven point. As explained, one of the characteristics of these points is that they regulate the ascending and descending of chi from the body to and from the head. They do so in the crucial neck area, the gateway between the body and the head. Therefore, they can both subdue rebellious chi and promote the ascending of clear chi to the head. So we have here illustration of lung 3 for cough, wheezing, somnolence, insomnia, sadness, weeping, forgetfulness, nosebleed, coughing blood, talking to ghosts. The first group of indications clearly refer to the effect of this point in promoting the descending of lung chi. The second group of indications refer to the mental emotional effect of this point in regulating the ascending and descending of chi to and from the head. In fact, insomnia is due to chi ascending too much to the head or not ascending from it, while somnolence and forgetfulness are due to clear chi not ascending to the head. The explanation of the acupuncture point says that lung 3 can make chi rise to treat forgetfulness, sadness, and weeping due to chi not rising to the head. Forgetfulness is an important indication of this point. This is forgetfulness due to clear chi not rising to the head. According to the explanation of the acupuncture points, this point treats forgetfulness by stimulating the ascending of chi of both lungs and heart. The sign of goiter is also related to the ascending and descending of chi to and from the head in the area of the neck. As the neck is the crucial crossroad road of chi on its way to and from the head, it is prone to stagnation of chi, which in time may give rise to some phlegm in the neck manifesting with a goiter. The regulation of the ascending and descending of chi by this point makes it also apt to stop bleeding. However, this is only bleeding upwards, such in epistaxis and hemoptysis. This point stops this type of bleeding by subduing rebellious chi. Finally, talking to ghost features heavenly in these points indication. Generally speaking, when ancient books mention such symptoms as talking to or seeing ghosts among the indications of a point, it means that the point is indicated for relatively serious mental emotional problems, and in particular when the mind is obstructed. Obstruction of the mind can potentially cause serious mental problems such as manic depression or psychosis. Again, this point can open the mind's orifices. That is, we obstruct the mind by regulating the ascending and descending of chi to and from the head. It opens the mind's orifices by promoting the descending of turbid chi from the head and the ascending of clear chi to the head. This is a general function of the window of heaven points. It is interesting to compare the names of lung 3, lung 1, and their implications. Who means phalas. This usually confers importance to a point, indicating that it is at the center of an important directing and governing structure as a phalas is. Lung 1 is the central phalas, while lung 3 is heavenly phalas. Lung 1 is the central phalas because although it is located in the upper chest, the lung channel originates from the middle burner and emerges at this point. For this reason, this point can also promote the descending of stomach chi. It has a certain effect on the middle burner, and it does not have an effect on the head. By contrast, lung 3 is a heavenly phalas, which means that its sphere of action is very much of the head, as indicated above. Summary, it regulates the ascending and descending of chi to and from the head, mental emotional effects of window of heaven point, for goiter. It also stops bleeding upwards.